We're here with Dr. Pulin Patel at the start of allergy season. Welcome, Dr. Patel.
Thank you for having me here today.
Thank you. Thank you for being here. And could you just share with us a little bit of your background?
Yes, I basically I did internal medicine internship at McLaren Macomb Hospital. And then I went to Detroit Medical Center to complete my internal medicine residency, and then followed that up with a pediatric and adult fellowship in allergy and immunology.
Okay.
And I'm now practicing in McLaren Macomb Hospital as an allergist.
So why do so many of us get allergies this time of the year?
It's a great question. So what I'm thinking is that the weather is the biggest thing that happens at this time of the year, especially in Michigan. We have a lot of warm weather that starts from cold weather and transition into warm weather. Spring, summer, into fall.
Okay.
What happens with the warmer weather, we have plants that bud, pollination that happens, the pollen gets released. A lot of patients, unfortunately, have a sensitivity to pollen. So in other parts of the country, people are used and exposed to that for most of the year. Michigan or Midwest, we have a lot of winter months, 6 months where the pollen is dead.
Right.
At this point, when the pollen starts coming out, we start having those symptoms. So at this time of the year, what the biggest factor is the environmental allergies.
Okay.
And this can be different types of pollen. There's tree pollen, grass pollen, weed pollen, and ragweed pollen. All come out at different times of the year.
Okay.
So it all depends on what each individual patient is sensitized to.
Are there other factors that can contribute to allergies?
Yes. So initially I mentioned that this time of the year, yes, we have a surplus of people with allergies.
Okay.
But it doesn't mean that allergies are only during spring or summer or fall. We have patients with winter or perennial, all year round allergies. So we have patients who suffer all year round. And these ones are mold spores, pet dander, which are cat and dog dander that triggers our symptoms.
Okay, so more indoor
allergies.
Okay.
So those can also contribute to some of the patients having worse outdoor symptoms, because if someone already has perennial symptoms and then they also have seasonal symptoms, that compounds the fact for those patients.
So we can have indoor allergies as well as outdoor allergies around the same time frame, and the symptoms will be the same?
Correct. So what happens is the symptoms are always the same, but
Okay.
certain things can actually make symptoms worse. So patients do have just even perennial allergies, just cats, dogs, mold spores, dust mite, and never have even seasonal issues. And they might have symptoms just for a couple months in certain times of the year, and we might contribute to that to environmental triggers like the pollen. But in reality, when we do testing, they don't have any pollen that shows up. It's just the indoor triggers.
Is there a certain time frame where it might become more severe than others?
Unfortunately for those patients with indoor allergies, it can be any time of the year. And that's the hard part with allergies. The hard part is if you have an animal dander, cat dander, dog dander, and you have pets at home, plus we all have dust mite. No matter what we do, we always have dust mite. There's certain avoidance measures we can do to try and minimize that.
And what would those measures be to minimize
So
dust
for
mites?
dust
'Cause I
mites,
know that
correct.
I probably have them in my house along with everyone else. And what can I do to diminish? Yes.
Correct, and this is the first step in any kind of avoidance kind of measures. Is first thing in allergies, always trying to do avoidance measures.
Okay.
So if we could talk about a few different things, I'll talk about just dust mite, but I'll also talk about other things we can try and help minimize.
Perfect.
Dust mite, the first thing and most important thing is washing everything in hot water. All the sheets, towels, bedding in hot water. Dust mite only unfortunately dies with hot water. So warm and cold water when we do laundry with sheets, towels, bedding does not help. The second most important thing is getting allergy-proof cover sheets for the mattress and the pillow. And that is found at all numerous stores, and that's the most important thing, is those two things. There's a lot of other things we can try and do that cost a lot of money, but the two simplest things, two most proven things are doing those two things.
And how often should that washing occur?
The washing should occur at least every week. So if
Okay.
you're doing the sheets, towels, bedding, every week you should be washing them in hot water.
Okay.
And also, obviously, putting the covers on, allergy-proof covers.
Okay, perfect.
Now, there's other
you
avoidance
said there
measures
was a
as well.
second one.
Correct,
Okay.
there's other avoidance measures. So that's just for dust mite. If you take pollen, for instance, and that's the time of the season that we're talking about right now.
Right.
So a lot of people, as I mentioned initially, it's tree pollen, then grass, weeds, and then ragweed. So if certain patients are allergic to one of the four or all four of the pollen, what you want to do, regardless of what you when you find out what you're allergic to, you need to, at that time season, for that season, you need to always have the windows closed at home. That's number one. Windows closed at home. When you're driving in a beautiful drive up north, you
Right.
want windows closed. You want to have less exposure to that pollen.
Okay.
But I don't want you staying indoors either. I want people to enjoy the weather. I want people to go outside. So they go outside. You have children, you have adults who go outside. You go for a bike ride, walks. When you come back indoors, you change your clothes, you wash up. You wash your face, change your clothes, wash your hair, So that helps reduce the pollen.
Okay, because a lot of the pollen can get
Correct.
stuck
It's
in
stuck.
your hair, and then you go on your pillow and you sleep on
Exactly.
your pillow, and then you're
Correct.
just transferring all the
Yes.
pollens. Okay.
It's in your pillow and your clothes. You're indoors for part of the day. You're sitting on your couch, anywhere else. So you want to try and change those kind of things. Even taking a shower at nighttime during spring, summer, fall season is the best thing because you're trying to wash up and get rid of all the pollen before you go to sleep. So these are small steps you can take for pollen avoidance measures. But I want people to enjoy themselves. I want people to go outside.
Absolutely, so beautiful outside. From being a parent of, and I have children that have severe allergies, what advice could you give parents to help with some of the symptoms as a young child or even teenager? Playing sports, let's say, and they're out in on a sports, a field,
Yes.
and there's a lawnmower, going by and cutting grass.
Well, the problem becomes how severe the symptoms are. I have patients who have very minimal symptoms. They could just have sneezing, runny nose, minimal symptoms. I would, at that point, it's doing with the avoidance measures we had talked about. As soon as they finish playing their sport, washing up, cleaning up, doing that. However, there's a lot of patients, unfortunately, symptoms step up further. They can't breathe through their nose. They're so stuffy. Eyes start swelling up, or they even have respiratory symptoms. Asthma symptoms start triggering up. If there's certain things that are getting worse and worse, unfortunately, at this point, we have to step in and try and do medications. There's a couple of different over-the-counter choices and prescription choices. But at this point is when we would add nasal corticosteroids, which are the mainstay of any allergic rhinitis. So nasal corticosteroids on a daily basis. These are prevention medications.
So the child or parent, they would have to take the medication on a
Correct.
daily basis.
On a daily basis. And the best thing would be to start it at least a couple of weeks ahead of time, ahead of the season. So if you have just tree pollen, which comes first, as I mentioned, that comes in early spring. So I'd want medications to be started by March, couple weeks before the season starts, so that way you at least have the medication in your system while you enjoy the sport or go outside and do the activities. Then it all depends on that. If that is able to sufficiently control your symptoms, that's all you need. The less, the better. Right. There are other steps out there. We can add oral antihistamines and other nasal antihistamines as well on top of these medications. And another class of medications is called leukotriene modifiers, which is a medication such as Singular, which helps with both breathing issues and allergy issues as well. But there's different levels, all depending on the symptoms the patient comes in with.
Okay. What is the difference? I hear this word used a lot, hay fever. What is the difference between hay fever and allergies?
That's the funny thing. So a lot of times when patients come in, do you have allergies? I'm using the word allergies. Do you have allergy symptoms? Runny nose, sneezing, stuffiness, congestion, itchy eyes, watery eyes. A lot of patients say no. They might have been sent for asthma issues or other issues, but I'm still getting a full history. Later on, I use the word hay fever. Do you have hay fever? Does your family? I'm getting a family history. Oh yeah, they go, oh yeah, I have hay fever symptoms. This. So to me, it is exactly the same symptoms. It's the same symptoms. So, but people equate hay fever to something different. In reality, hay fever is allergies. Allergies are hay fever. So to a medical professional, it's the same thing. It's the understanding by the patient or the population. They might think it's something different. It is not different. It is the same thing. So as a physician, I have to understand that, and I have to try and bring about questions by asking it various different ways. If I want answers for something, it's hard to always get the answer the first way or the right way because patients in front of me don't understand what I'm always talking about.
Right.
So you always have to try and figure out different ways of bringing about it. And that's one of those things is actually saying that word, hay fever. It's a trigger, but it is exactly the same word. It's allergies. Now, some people will say hay fever just because they only have spring or fall or summer symptoms.
That's what I always thought.
Correct.
Hay fever was just in the fall.
Fall and or spring or summer, people might say that. But regardless, it's the word. It's still part of allergies. You still have allergies. You can have seasonal allergic rhinitis, or you can have perennial, which we had talked about. But they're all the same condition. Now we just have to differentiate what you have, what's triggering it, and how to try and fix that problem.
Wow, you have given us some great advice on allergies, the difference between environmental allergies, indoor, outdoor allergies, and we really appreciate you sitting down with us today. Thank you so much for coming to the show. Is there anything, one more tidbit of information you could give our viewers today?
Well, what I would tell patients is I still want patients to enjoy life, regardless of what your allergies are. I still want you to enjoy it. But as I mentioned before, there's a lot of different avoidance measures. You can have avoidance measures for dust mite. We didn't go over all the different ones. There's pollen avoidance measures, pat dander, mold. We want to go over all that kind of stuff. So I still want patients to enjoy themselves, but there's different avoidance measures people can start taking, implementing, that can help reduce how their symptoms will be affected by the environment they live in. So if we are able to do that and minimize that, they can still enjoy a full life and healthy life and be happy, basically.
Okay.
So
And
regardless
are
of
your
what
patients
allergies,
pretty compliant too? Do they listen to you?
yes, I think the patients who actually have suffered and are actually finally seeking this an allergist profession, because a lot of times patients go over the counter. There's a lot of over the counter medications. Then they have primary care. Then they have primary care physicians they can go to, obviously. So if they're seeking health from an allergist, I think at that point they're actually willing to take the extra steps and go into trying to listen to what we want to try and do, because it's not always medication,
Right.
or allergy shots. It's part of avoidance measures as well, and that actually helps simplify things. But I still want people to enjoy themselves.
I do too. Most definitely, especially with all the beautiful weather that
Yes.
in the winter and summer too.
Yes.
And we thank you so much today for coming in and sharing all of your experiences and advice with us. Take care
Thank you.
and have a very good day.
Thank you so much.
Okay.
For more on allergy prevention, visit mclaren.org/Macomb Allergy.